Greetings everyone, today our group is going to present about rotator cuff tendinitis. First of all, we have to know what is rotator cuff and also tendinitis. Let me clarify for you. Rotator cuff is basically a group of 4 muscles which is tendon inserted into our shoulder. It consists of supraspinatus, infraspinatus, scapularis, and teres minor muscle, while the term of tendinitis relate to the inflammation process of a tendon. By combining them as a word, rotator cuff tendinitis means the tendon of these 4 muscles become inflamed or irritated. These symptoms usually causes pain and decrease in motion in shoulder. Rotator cuff tendinitis occurs due to a combination of mechanical and biological factors that lead to tendon damage. First, narrowing of the subacromial space creates mechanical compression of the rotator cuff tendons, particularly the supraspinatus tendon during arm movements. This compression combined with repetitive stress leads to micro tears in the tendon fibers. These micro tears trigger an inflammatory response, resulting in pain, swelling, and increased sensitivity around the shoulder. Over time, the tendon's ability to heal is compromised due to their poor blood supply, which leads to weakening and degeneration of the tendon tissue. If this condition persists without treatment, the tendinitis can progress to tendinosis, characterized by chronic degeneration and disorganized collagen, further reducing the tendon strength and function. Moving on to the causes, which is the etiology of rotator cuff tendinitis. Rotator cuff tendinitis is commonly caused by repetitive overhead activities that place significant strain on the rotator cuff tendons. Sports such as swimming, tennis, baseball, and throwing activities are notable examples. These repetitive motions can lead to overuse and irritation of the tendons. Another common cause is shoulder impingement, which occurs when the space between the humerus and the bony roof of the shoulder, known as the acromion, becomes narrow. This narrowing results in compression and irritation of the rotator cuff tendons, contributing to inflammation and pain. In addition to overuse and impingement, rotator cuff tendinitis can also result from traumatic injuries. Events such as fall or a direct blow to the shoulder can cause significant damage to the tendons, leading to acute or chronic tendinitis. As rotator cuff tendinitis primarily involve an inflammatory process, the 5 cardinal signs of inflammation are often observed. These include: first, redness or swelling around the shoulder region, indicating the localized inflammation. The second will be pain or tenderness in the shoulder area, typically worsening with the movement or pressure. The third will be the loss of function. This characterized by a limited range of motion in the shoulder joint, making activities such as lifting or rotating the arm difficult. The fourth will be a cracking sound during the movement, which we call as crepitation. This occurs due to the tendon irritation or friction within the joint. The last will be the muscle weakness resulting from the tendon's inability to efficiently transfer the force, further impairing the shoulder function. These signs collectively highlight the inflammatory and mechanical impact of rotator cuff tendinitis, significantly affecting the shoulder mobility and strength.
Next, we are going to talk about the inflammation process of rotator cuff tendinitis. When there are micro tears of rotator cuff, these injuries release damage-associated molecular patterns, which known as DAMs. DAMs are molecules released from damaged or dying cells that trigger the innate immune system. DAMs trigger cells in the area to release chemical mediators such as histamine and prostaglandins. These chemicals kickstart the inflammation process, causing noticeable signs like redness, swelling, and warmth. Histamine stimulates the body's immune response by regulating the maturation and activation of leukocytes and causes the nearby blood vessels to dilate, which we know as vasodilation, which increases blood flow to the affected area. This allows more immune cells, nutrients, and oxygen to reach the site of injury to begin the repair process. For prostaglandins cause blood vessels to leak fluid into the tissues, which causes swelling. This helps isolate foreign substances from the body's tissues. Here comes the stage in which endothelial cells increase permeability. Histamine contributes to the gaps between endothelial cells by causing active contraction of actin filaments, allowing more fluid, antimicrobial chemicals, and monocytes to squeeze in the form of exudate through interstitial space, heading to the inflammatory area by delay persistent response. This fluid buildup contributes to swelling and prepares the area for healing. Okay, now come to the cellular response. Within short term, neutrophils as the first respondent engulf and digest pathogens, helping to prevent infection, and phagocytosis of bacteria is accompanied by neutrophil degradation and also superocyte production, then followed by neutrophil apoptosis, which attenuates inflammation, leading to resolution process. Resolution here refers to the process that turns off inflammation and restores the tissue homeostasis. After the neutrophils, macrophages arrive to clean up the area. They clear dead cells, remaining debris, and lingering pathogens through the phagocytosis process. They also release signals to promote tissue healing or, in some cases, sustain chronic inflammation. The buildup of fluid, chemical mediators, and pressure in the area activates pain receptors, in which causing pain. Depending on the balance of inflammation and healing, two outcomes are possible. For the first one, there will be chronic inflammation, which is the inflammation persists, can lead to ongoing pain, tendon degeneration, and also reduced function. And the second possible outcome will be healing, as if the inflammation resolves, the body repairs the tissue, possibly forming scar tissue, restoring some or all the tendon's function. Here are some treatment suggestions that we can perform onto the patient who's having rotator cuff tendinitis. So the first one, apply ice packs to the shoulder. So the treatment time is 15 to 20 minutes per time, several times a day. It can help to reduce the pain and inflammation. Next one is undergo physical therapy. It can help to improve range of motion, strength, and posture, aiding in recovery. Besides that, the patient also can take pain medication such as over-the-counter options like the ibuprofen or acetaminophen can help to relieve pain and inflammation as well. Stronger medications may be prescribed by the doctor in some cases. Also, undergoing surgery may be necessary in rare cases to repair a torn rotator cuff tendon, especially if conservative treatments fail and the pain is severe and disabling. Besides of treatments, there are preventions that can be done to prevent us from getting the rotator cuff tendinitis. The first one, always maintain good posture while sitting, standing, and walking. It can help prevent strain on the shoulder muscles. Also, maintaining a healthy weight can reduce stress on the shoulder joints. It is because excessive weight increases strain on your shoulders and upper body during daily activities. This added load can overwork the rotator cuff muscles and tendons, leading to inflammation and injury. Other than that, strengthening exercise of the rotator cuff muscles will be beneficial. It can help to improve the stability and also reduce the risk of injury. Last one, remember to warm up before physical activity and cool down afterward. It can help to prepare your muscles for activity and reduce the risk of injury during the activity. That's all from us. Thank you.